Hello everyone, I'm Dr. Y. Coney and welcome to Bright Star Baby and Child Clinic. In this video, I would like to talk about an issue that faces a lot of stigma and many parents are ashamed to talk about it, but it is a very common problem. In this video, I would like to talk about bedwetting. I'm sure a lot of you have experienced this before yourself or you know of someone who has this issue. So what is bedwetting? Bedwetting is when a child is old enough to be expected to control his or her bladder, but somehow involuntarily releases urine at night when asleep. It is also called nighttime incontinence or nocturnal enuresis. Did you know that there are millions of children around the world with bedwetting? If your child wets the bed, he or she is not alone. Now, bedwetting is a common problem amongst children, particularly in those under 6 years old. Even though they have been toilet trained and they are dry in the daytime, it is usually considered a problem after they are 7 years old and they continue to wet the bed 2 or more times a week for more than 3 months. Most children are toilet trained around 2 to 4 years old, but some children may not be able to stay dry at night until they are much older. Now please remember, every child develops at his or her own rate. Try not to compare with another child or even amongst siblings. Just to share with you some statistics of bedwetting, 20% of 5-year-olds still wet the bed, 10% of 7-year-olds wet the bed, and 5% of 10-year-olds too. About 2 to 3% of people over the age of 18 still wet the bed. Bedwetting also occurs more commonly among boys. Bedwetting is not a serious medical condition, and it is often just a normal part of life and is a normal part of a child's development, but it can be challenging for parents and the child alike. And it's a little bit embarrassing, isn't it? Children who wet the bed may feel ashamed. They might avoid taking part in overnight activities such as camping or sleeping over at their friend's house because they are worried they might wet the bed while they are away from home. Now, what causes bedwetting? No one knows for sure what causes bedwetting or why it stops, but it's often a natural part of development and kids usually grow out of it naturally. Most of the time, bedwetting is not a sign of any deeper medical or psychological issue. However, experts have identified several factors that may lead to higher incidence of bedwetting, such as a small bladder. Your child is a deep sleeper and does not awaken to signals of a full bladder. If there's a family history of bedwetters in close relatives, for example, parents or siblings. There might be hormonal imbalances in the child. Some children during childhood do not produce enough ADH or antidiuretic hormone to slow nighttime urine production. Some children have an inability to recognize a full bladder due to the nerves that control the bladder are slow to mature. Or your child may make a lot of urine at night. Your child might also be constipated, so full bowels can put pressure on the bladder and lead to problems with holding and emptying urine as well. Your child may have a urinary tract infection. Some psychological or emotional issues, for example, stress at home, major conflicts in the family, major conflicts in the child's life, divorce, a new baby, moving house, may lead to higher incidence of bedwetting. Certain medical conditions can also lead to bedwetting, for example, diabetes, sleep apnea, or certain neurological problems. Now, how does one manage bedwetting? Firstly, it is very important to be emotionally supportive of your child and do not put blame on him or her or make them more ashamed than they already are. Please tell them it is not their fault. Try not to make a big issue out of it and also be sensitive to their feelings. You can try by first protecting the mattress by putting a cover on top of the mattress. Let your child clean up the mess together with you, as this fosters responsibility in your child, but do not make it like it's a punishment. Have your child use the toilet just before bedtime and avoid drinking large amounts of fluids before sleep. Please limit caffeinated drinks or soda in the evenings, as this may cause more urination. Try to wake your child up 1 to 2 hours after sleep to use the toilet. You can also try rewarding your child for dry nights. Offer support and encouragement, but not punishment. If your child has any underlying medical conditions, treat those conditions first before managing the bedwetting. For example, constipation or urinary tract infection. If psychological reasons are the cause, please also manage the emotional aspect first before tackling the bedwetting issue. Please know that most children outgrow bedwetting on their own without any intervention. Now, what are some of the treatments for bedwetting? Some common treatment options include alarms and medications. First, we'll start with the moisture alarm or the enuresis alarm. These are small battery-operated devices that make loud noises or vibrate to awaken the child when in contact with moisture or when he or she wets the bed, so that the child can wake up and go to the toilet. It often takes more than 3 to 4 months before one sees any results. Moisture alarms are effective for many children, about 50 to 75% of the time, and it carries a low risk of relapse or side effects and may provide a better long-term solution than medication does. Bedwetting alarms tend to be most helpful for those children who are deep sleepers and have some bladder control of their own. The second one is using medications. Usually, as a complementary method to the alarm or as a last resort, doctors might prescribe medications for your child's bedwetting. There are medications that can slow down urine production or calm down the bladder contraction. But be aware that taking these medications are not without its side effects. So as I mentioned just now, a combination of alarms and medications might help some children more. Well, the treatment usually involves the help of a pediatric urologist, which is a specialist in treating urinary problems in children. Other ways of treatment include bladder exercise. This approach is aimed at gradually increasing the capacity of the bladder by making your child wait a while before going to the bathroom to urinate, so that it trains the bladder to hold on to more urine. Some parents choose to use alternative methods in treating their child's bedwetting, and some of these methods are not scientifically proven. Now, please be aware that these methods have limited scientific background and may be very expensive and may harm your child too. Lastly, try to be positive. Do not be discouraged if at first the methods didn't work. It may take some time. Also, try to remind yourself that kids do outgrow this condition by the time they are teens. Meanwhile, help your child go through this period by offering lots of support and encouragement. Soon, you will see dry nights. That's the end of this video. It's a very short one. I hope you enjoyed the video and thanks for your time. Meanwhile, stay safe and take care. Thank you. Bye.